Para quem não me conhece, eu sou Mauro Fisberg, coordenador da Força Tarefas de Estilos de Vida Saudável do ILSE e membro da diretoria do ILSE. Nós vamos ter, então, uma segunda mesa, que nós vamos falar mais principalmente das algumas alterações metabólicas, como a resistência à glicose e a segurança dos edulcorantes para grupos de risco. Só para a gente poder conceituar, realmente algumas características são interessantes para completar o que foi colocado na primeira parte, de que parece que nos estudos epidemiológicos brasileiros, quando nós avaliamos os dados de ingestão de adoçantes, o volume de ingestão é muito baixo. E, realmente, quando nós avaliamos o consumo percentual desses adoçantes em relação aos açúcares de uma forma global de adição, o consumo de adoçantes é muito pequeno e acaba sendo irrelevante do ponto de vista epidemiológico. No entanto, nós continuamos prescindindo da necessidade de fazer estudos que sejam de análise prospectiva e que sejam possíveis de serem avaliados de uma forma controlada por algum tempo de avaliação. Então, acho que é muito importante, especialmente quando nós discutimos as possibilidades de prevenção para as doenças do futuro e a utilização por parte de grupos específicos, como crianças e adolescentes. Nós vamos ter a primeira apresentação da segunda parte, com o tema Edulcorantes e Resistência à Glicose, ou Sweeteners and Glucose Intolerance, com o professor Craig Johnston, que tem BS em Psicologia na Universidade de Iowa, e ele tem mestrado em Psicologia Clínica pela Southwest Missouri State University e doutorado em Psicologia Clínica Infantil na Universidade do Kansas. Ele foi também professor auxiliar no departamento da Faculdade de Medicina da Baylor, no Texas, e foi professor auxiliar do departamento de Nutrição Infantil do Centro de Pesquisa e Nutrição da Criança, também na Baylor, Texas. E atualmente é professor do departamento de Performance e Saúde Humana na Universidade de Houston. Logo em seguida, nós vamos fazer a apresentação do tema Edulcorantes são seguros para gestantes e lactentes, crianças, com o professor Norberto Gílio, que é do Hospital de Ninhos Ricardo Gutierrez, de Buenos Aires. Ele é pediatra, com atuação em farmacoepidemiologia, professor na Universidade Austral, e trabalha no Departamento de Epidemiologia do Hospital Infantil Ricardo Gutierrez, em Buenos Aires. Ele é médico pela Universidade de Buenos Aires, com mestrado em farmacoepidemiologia pela Universidade Autônoma de Barcelona. Ele tem vários prêmios e ele é atualmente presidente do Conselho de Pesquisa da Sociedade Argentina de Pediatria e membro da Sociedade Internacional de Farmacoeconomia. Então, vamos começar com a palestra do professor Craig Johnston.
Thank you very much. And thank you for inviting me to be here. Brazil's a wonderful place to be, and I've really enjoyed my time. But I think it's important that we get together to talk about these really important issues when it comes to health, when it comes to lifestyle. I get to give two talks today, and one is on glucose intolerance, and then a related topic on obesity and obesity management and lifestyle management. And both of these are very much similar topics. I'll be talking about different things on each one, but these are two health concerns that I think are maybe some of the most important health concerns that we have going on in terms of globally, and definitely we see this taking place in Brazil and the United States, like I said, across the world. So it's my pleasure to come and to be able to talk about that today. What I hope to be able to do is to talk about the evidence regarding the impact of artificial sweeteners on health in general. In this talk, I definitely want to talk some about the microbiome, and I want to give the strength of the evidence about what kind of impact, if any, we feel like artificial sweeteners might have on the microbiome. So, like I said, I think that diabetes is one of the biggest topics that we have that are facing us today. The prevalence of diabetes has more than doubled in the past 30 years, and we see that this isn't just in specific countries, but this is really worldwide. We anticipate by the year 2035 that the prevalence of diabetes in the world will be close to 600 million individuals. And this should be of great concern to all of us, because the management of type 2 diabetes, to effectively manage this, the costs that will be associated with this will be astronomical. To understand the cost that goes into yearly diabetes treatment, effective diabetes treatment, I think that a lot of countries will just simply not be able to sustain the kind of treatment that would be needed to take place to effectively intervene with their population. The good news about diabetes prevalence, I think, is that the strategies to prevent and manage diabetes, we know what they are to a large degree. We know that has something to do with energy balance. We know that has something to do with lifestyle management. We definitely do have pharmacology to help with this as well. But I think we're getting a better and better idea about how do we prevent and how do we manage this through lifestyle. Because one of the strongest associations with the development of diabetes is excessive weight gain. And you'll see my simple diagram up here that cardiovascular disease, I think it feeds directly into, like, the main culprit of cardiovascular disease is obesity. I think the same thing is true with diabetes. There's multiple other health problems, including cancers, including joint and bone problems, right, that are really driven by this issue of obesity. And so what do we do about all of that? It's really some sort of lifestyle management. And what I mean by lifestyle management is really energy in and energy out, right? It's energy balance, and that's what we're looking at. And that's why I think artificial sweeteners play a huge role with what we talk about, because they play a huge role in the energy in part of this, possibly. And that's why it's really important to have this conversation about, realistically, what artificial sweeteners might do. Reduction in weight has been recommended for both diabetes prevention and management. And in some studies that have taken place that I'll talk about in a moment, we actually see the reversal of type 2 diabetes if people can change their lifestyle substantially enough. And so I want to make sure we're really clear on how we treat, manage, and prevent diabetes. And then we're going to see if that evidence matches up with some of the evidence that's being suggested about how diabetes might develop. Because if we know how to treat it, it should give us an idea of really the main culprit in the development of it. And so two studies that really excellent studies. If you want to learn about the prevention or the treatment of diabetes, these are both the Diabetes Prevention Program and Look Ahead. They're two of the largest studies and longest term studies that have taken place in this. The Diabetes Prevention Program is doing exactly what you see in the words, right? It's saying what has to happen in order to prevent people that are at high risk for diabetes to actually reduce the incidence of diabetes taking place. And the study took place for a very long time, and what they found was with lifestyle management, there's a 58% reduction in the incidence of diabetes. And this is a randomized controlled trial, and I can't tell you the importance of the evidence of randomized controlled trials. We will at one point talk a little bit about epidemiological studies. We'll talk about animal studies. But what we need more than anything, when we can do them, are randomized controlled trials in humans. It is the gold standard. Whenever we read a study that is not a randomized controlled trial in a human, we have to think about what's the applicability, what's the generalizability of that study to other human conditions. Look Ahead was a little bit of a different study that took place. And what they did with Look Ahead, again, they're providing lifestyle management. But they recruited predominantly sick people, older, sick people with diabetes. And the reason they did this, they actually wanted to look to see if you lose weight, do you live longer? The primary outcome of Look Ahead was death. And so the idea that if you lose weight, you'll be healthier and you'll live a longer life, we think that and we believe that. The issue is we've never shown that scientifically. And so Look Ahead actually took people that had diabetes, they recruited them, they treated them, and then they said, now the intervention group that gets lifestyle management and treatment, when they reduce their weight, by the way, Look Ahead was did a very great job of getting people to reduce their weight. They said, now, will that result in a longer life, right? So they definitely showed modest weight losses, and what I mean by that is weight losses between 5 and 10%. When we're looking at clinically significant weight loss, we're really looking at 5 to 10% weight loss. 5 to 10% weight loss does amazing things for the body. If you want to improve your blood pressure, lose 5 to 10% of your body weight. If you want to improve your blood sugars, lose between 5 and 10% of your body weight. And really, that doesn't matter how overweight the person is. Really what we're looking for is a 5 to 10% weight loss. And so that's what I mean by the modest weight losses. That resulted in partial or complete remission of diabetes in almost 12% of patients receiving the intervention at 1 year. And that was in 8% of patients at 4 years. And so what we're seeing here is that really what's going on in the diabetic individual is this issue of excessive weight. It's the issue of how the body is responding to that. And when we are successful at lifestyle management, diabetes is managed and it's managed well. So I want you to remember this very simple point as we move forward and as we talk about some other things. Lifestyle management is really the key in treating and preventing this disease. And I think that it has something to do with the development of the disease, because probably the development of the disease is the opposite of lifestyle management, right? It's probably this idea of excessive weight gain, and that is the preponderance of the evidence, I think, would suggest that when you gain too much weight, diabetes is the result of that. That is not true for all individuals. There are definitely people that are at higher risk regardless of weight, and that has a lot to do with genetics and what would take place. But the modifiable factor that we have is our lifestyle. The thing that we can do to change is our lifestyle. So what does that mean? Lifestyle management is really limited in maintaining healthy changes long term. This is the problem with lifestyle. We can get most people to change their lifestyle for about 6 months, and then they get very tired of what we've asked them to do, right? Obesity is a very intractable disease. It's one in which people will make changes in the short term, but in order to get them to make changes in the long term, that is still the missing piece of where we're at. How do we encourage you to make some shifts in diet and physical activity that you'll say that you'll do for a very long amount of time, right? Part of the issue with that is when someone comes in to see me for lifestyle management, when they come in and they say, I need to lose weight, either for diabetes or for obesity management, I'll tell them what I'd like to see them do is we need to make changes, and the goal of our treatment should be that we reach 5 to 10% weight loss in the range of 6 months to a year. And if you've ever tried to lose weight in the past and you came into me and I said you need to lose weight and that should be done over 6 months to a year, you're probably going to get frustrated with me and walk out because you wanted to lose weight yesterday, right? That's how we all want to do it. It's not, right? Like, don't talk to me about 6 months. And what we know is that most people say it's 3 months that I'm willing to give you. Because, at least in the U.S., we have something called bikini season, right? Where people are thinking, I know that's coming when I have to put on a swimsuit and I want to look okay in that. And I think about that about 3 months in advance, okay? And so we know that a small changes approach is the approach to go with. How do we make small changes gradually and build on those small changes to have successful weight loss? People do not want to do small changes. We want large changes that will be impactful quickly. And as a matter of fact, this is one of the most dangerous things that I think you see happen in some individuals. In order to lose weight quickly, they will go to very extreme measures. One of the more recent things that we've seen in the U.S. are, especially we see this in young women, where they're dipping cotton balls in lemon juice, because lemon juice will help you to not want to eat as much, and they swallow the cotton balls, and so the cotton ball sits in the stomach, and it creates a feeling of fullness, And so then they don't feel like they need to eat. Now, I hope you're thinking to yourself, that is a ridiculous, terrible thing to do. Because it is. And not only that, but it can do terrible things inside of your gastric system, right? Like it can clog up your stomach to where we have to go in and do surgery in order to remove cotton balls that you've ingested. But it gives you an idea of just how dramatic people will be in order to be able to lose weight and to manage weight, and how this idea of small changes is really a difficult one to get across. It's a difficult one for people to say, yeah, I'll do that, and that's something that I'm willing to take the time and take the effort to make it happen. But we know that the small changes in diet and physical activity, from the studies that I've just talked to you about, it can have substantial impact in the prevention and management of diabetes. We know that low-calorie sweeteners can help to reduce caloric intake, and we know that they can aid in maintaining a healthy weight. The American Diabetes Association, the American Heart Association, the Academy of Nutrition and Dietetics, all of these groups will look at the preponderance of evidence, and they've made these statements very clearly and very openly. We also know that low-calorie sweeteners are safe, as has already been discussed, and I'll talk a little bit more about that. We know that for the most part they're inexpensive, and they definitely fit within this idea of a small change strategy. Some groups have formulated what the caloric deficit would need to be in order to reduce obesity in the upcoming years, and really what they estimate is 100 calories a day. If we could reduce, everyone could reduce their intake by 100 calories a day, that we could impact the obesity epidemic. And so that's really what I mean by a small change strategy. 100 calories a day is not very much at all. And people always like to point out the junk foods that you could get out of your life for 100 calories a day. I'd just also tell you that probably if you ate an apple less a day, that's what we're talking about, right? Like it is a very small amount of calories that we'd be discussing in order to make that kind of a small change. So sweeteners, low and no calorie sweeteners, they've been in use for many years, right? Saccharin in 1878 was discovered. And there's definitely more recent ones, and they're not all on here. But these have been a part of the food system for a very, very, very long time. These have been a part of the food system before we had significant issues with diabetes as well. And so I would have you remember that although we talk about how this might impact glucose intolerance, we've only started talking about that recently when these have been in foods for a very, very long time. The use of sweeteners is increasing a little bit as well. And so that may be part of why people are discussing this issue, right? Like we see this slight increase in the use of sweeteners. Probably the increase in the use of sweeteners is because we're responding to an obesity epidemic. People are asking more and more that we need fewer calories in the foods that we eat. And so industry and others have been pushed to say, how can you create substances that I enjoy and that I like for fewer calories? And so definitely I think that you see the momentum being pushed to say, how do we use these low-calorie sweeteners more? But clearly there's a controversy, right? And so epidemiological evidence, studies in which we say this observed human behavior over the course of time, or in just a single time, there's definitely epidemiological evidence to say low-calorie sweeteners might pose a threat. And definitely rodent studies. There's some rodent studies that show that low-calorie sweeteners may pose a threat. Now, I will tell you that the randomized control trials that we'll talk about, I think clearly show the safety and efficacy of low-calorie sweeteners. And so I want to talk to you a little bit about where some of these headlines come from, because I truly believe that science is the right way for us to figure out how to improve the quality of human life. And so when science is used appropriately, like we can come up with great answers to things. When science is used inappropriately, we can cast fear on things that might promote health, right? When science is used inappropriately, what we can do is we can really scare people into saying, like, don't do these things that might be beneficial. And so I think it's really important to look at how science might point to some issues with low-calorie sweeteners. And then we need to make a decision about how strong is the evidence of that. And so, like, these are just a couple that I've pulled up, and there are so many. And I hear people send me these all of the time. I get about one per week about how a low-calorie sweetener can impact your health in one way or another. And so, again, in rodent studies, some rodent studies have shown that low-calorie sweeteners might cause weight gain. Some have shown that they might stimulate glucose absorption. Some have shown they might increase insulin release. And I want to be clear, that is not what all of the data show. I'm showing you just a few studies where a lot of other studies have not shown this impact. But this is where the headline comes from. There's also epidemiological studies that show they may increase appetite or they may cause weight gain. So what I'd like to do now is just show you kind of how the media might present this. And we've already talked a little bit about the media, but I think this makes the point really clear. South Australian researchers, this is exactly what was said, have found that women, please pay attention to women, who overindulge during pregnancy are more likely to deliver children with unhealthy cravings. The researchers have not suggested women cut out junk food altogether during pregnancy, but that women should stick to the guidelines of a normal balanced diet. They said, while the negative effects of eating junk food during pregnancy can